In our Health Watch report, researchers share interventions to help breast cancer survivors not have to have the fear of their cancer returning. Local 3's Connie Fellman has more.
3.8 million women in the U.S. are breast cancer survivors. They've either heard the words "you're cured" or they're still being monitored. And for many women, there's overwhelming fear the disease will come back. So researchers are trying to find the best way to help survivors face those fears.
There's always something happening in the Lyons family backyard. Kristen fought hard for her family to get to this point. She was diagnosed with breast cancer at age 39.
I was thinking about my kids and, oh my goodness, what does this mean for our future?
Kristen had treatment and beat the cancer. She rang the clinic bell, signaling the all clear. But that started an internal battle that got worse.
I thought, I should have a new leash on life because here we are, cancer-free, you know, and instead I found myself getting more and more worried and anxious.
The number one problem that almost every cancer survivor that I work with has dealt with is the fear that it's going to come back.
Johns and her colleagues conducted a clinical trial comparing 3 interventions for people struggling with fear of cancer recurrence. The researchers found one method proved significant reduction. It's called Acceptance and Commitment Therapy, or ACT.
We're all going to have thoughts and feelings that are uncomfortable. They just kind of naturally come into our mind. So it's about accepting those thoughts and feelings without necessarily getting hooked by them.
Johns and her team met with survivors for 6 weeks and used mindfulness practices like meditation to help them focus. Then patients developed a personal plan to give priority to their values, activities, and people important to them. Kristen calls ACT life-changing.
I go down the worry path, but I now have the tools to rein it back in, and that's made all the difference.
Acceptance and commitment therapy has been around for 2 decades, but Shelly Johns says it's never been used to help people struggling with fear of cancer recurrence until now. And that's your Health Watch. I'm Connie Fellman, Local 3 News.